point of care ultrasound. This is a general talk about the versatility of ultrasound and how it's become really a modern diagnostic tool that can be used at the bedside and in fact in many settings. Just a brief my background. So I trained in medicine, hospital medicine to the level of registrar, became a member of the Royal College of Physicians, and then went into radiology and was really excited when I saw the ability of ultrasound, what it could do for the benefits of patients. And I used my physician's background to talk and use ultrasound in my clinical practice. So we talk about point of care ultrasound. It's really, there's a huge demand for it in the UK. About 20 years ago, it started with smaller units, and America really took off and set up lots of colleges of ultrasound. Europe have been using it for 20 years, and we're catching up in the UK at the moment. So what is point of care ultrasound? Well, it's a point of care where ultrasound is with interaction between the medical professional, healthcare professionals, and patients. It's basically anywhere. It can be on the side of the rugby pitch, in an ambulance, in ITU, A&E. I've seen it used at pop concerts or music venues, concerts, and even in the radiology department, where actually ultrasound was really developed. 50 years ago, ultrasound was invented with physicists, and really there are some doctors who are radiologists who really developed ultrasound into what is now a very reliable diagnostic tool. So where did point of care start? Well, I think it's really interesting here. So this is Madame Curie, Marie Curie, sorry. In 1914, in the beginning of the First World War, she was already a Nobel Prize winner in France. She's Polish. She fell out of favor. She had an affair with a married man, and she fell out of favor with the populace in France. But this didn't deter her, because basically what she did, although X-rays had only been invented about 10 or 15 years earlier, she set up a set of these vehicles that contained X-ray units, and she travelled up and down with a group of women up and down the Western Front, X-raying soldiers for 4 years in World War One, and they were able to locate radiopaque foreign bodies or shrapnel or bullets, and aid the surgeon to remove these for these soldiers. And it's said that she helped over 900,000 troops on the Western Front by helping the surgeon to locate these foreign bodies. And so she did an incredible amount of work. And this is really where point of care came, taking the X-ray to the patient on the front line and providing guidance for surgery. And I think this is the earliest of diagnostics, certainly point of care, using imaging. So I presented this to Bemis, a group of us from St. George's, where we saw there was a similarity between what Marie Curie did and also ultrasound, the ability to have it, say, in a very austere location. You can have a clinic and using ultrasound as an adjunct to the clinical examination to diagnose things like fractures, soft tissue injury and fracture. This is a rib fracture here, loss of cortex, and here is subperiosteal hematoma. Chest examinations, effusions. There's something called a FASH scan, which is done in Africa, where they've got endemic HIV and TB, and they use a 6-point scan looking for nodes and fluid to include or exclude TB and HIV. Obviously examine the heart. Patients who've got heart failure could examine the size of the heart, the LV function. If you were very good at it, you should check valvular function. You could measure the JVP, and you could look for pleural effusions. This is in the absence of X-rays. This is a field hospital where there are no X-rays whatsoever. And again, we all know that ultrasound is extremely good at including or excluding masses in the abdomen and very good at delineating the anatomy of the abdomen. So ultrasound in austere locations is an exciting prospect and can have an impact on the future of developing world medicine. Well, I completely want to reiterate that. And ultrasound can be used anywhere, in the helicopter, the ambulance. Here it has been used in the ambulance or the air ambulance. We have it used in the ambulances in the UK. Patients who've got shock and abdominal pain, an ambulance attendant or paramedic will examine the abdomen, look for an aneurysm, and if there is an aneurysm, take the patient to a vascular center where they can have the aneurysm repaired, and it's sort of improved triage and can save lives. And we can use it in all settings, examining the chest, examining pregnant women, and obviously vascular access. And these are the origins of ultrasound. To just give you some perspective, I love perspectives, which are history and geography generally. The origins of ultrasound 50 years ago. This is Ian MacDonald, who was the pioneer. He was an obstetrician in Glasgow with two physicists, Tom Brown and another chap called McIver. The machines were huge, and they were based on sonar. So you ring a bell on the surface of the skin and then listen for an echo. And they took up rooms, huge rooms. They were very, very primitive, but they did form an image. And eventually, with the evolution of technology, this is a large one that we have in our very high quality, very expensive in our department. And we run an ultrasound department with 6 to 10 rooms, seeing 100 patients an hour. I really enjoy being part of that process as a consultant, looking at difficult cases and difficult images and diagnosing patients. And then about 2000, a smaller unit was produced. Moore's law is where the computing power increases and the size of your equipment decreases. And the butterfly I've mentioned before on previous talks. So here's a very interesting question about the point of care ultrasound. What percentage of the world's population has access to X-rays? We take it for granted in the UK that everybody has an X-ray department in every hospital, but that's not true. If you look at the world as a whole, the World Health Organization say only 25% of the world's population has access to X-ray imaging. And point of care or developing world ultrasound can be of use, and particularly in Australia and Canada, where there are modern medicine meets remote areas. Ultrasound can be used to triage and make decisions on patients. Let's look at this case here. So here we are in a village in Africa, patients who are pregnant. Ultrasound can be used to triage patients into high risk and low risk pregnancies. We presented this to Bemis. The use of ultrasound point of care obstetrics. These are not complicated ultrasounds. There you can tell how many babies are in the womb. This is late in the pregnancy. Whether head up or head down, are they breech or not? You can tell whether the baby's alive or dead. And you can see where the placenta is. Is it low lying or is it placenta previa? All of these are very useful because if it's a normal head down pregnancy, then it can be delivered in the village. But if they've got complications, they can be sent to a tertiary centre, which is probably a long distance away. This would have an impact on patients' maternal mortality and perinatal mortality. And again, I've mentioned already on a previous talk about the use of it in failures and renal failure, looking for obstruction. It can select out patients who benefit from surgery or intervention in patients with renal failure because it can see the anatomy. If you have to say what's the summary of what ultrasound is, it's about demonstrating the anatomy and pathology. And again, in jaundice patients, you get dilated ducts. This is a post-hepatic cause of jaundice. This is a surgical case, not a medical case. Think about pancreatic tumours or stones in the common duct. I've been called in on weekends to examine patients with ultrasound by the surgeons, because they know if the ducts are not dilated, it's not their case. If the ducts are dilated, it's a surgical case. If I went and saw a small shrunken liver, which is knobbly with ascites and a large spleen, that is a medical cause of liver dysfunction. And let's go back to where we started. Ultrasound, the point of care of conflict ultrasound in Syria. This is David Knott, who runs a surgical team that go out from the UK to help people in war-torn areas. Recently had a talk on ultrasound. It was about point of care ultrasound. Marie Curie did it in 1914 with the X-rays on the front line of the of World War I, the trenches, Belgium and France. And here you have an ultrasound machine in a pretty bombed hospital. But what can ultrasound tell you on the battlefield? Well, ultrasound is fantastic for foreign bodies, so it will be able to see the bullets in the liver and exclude any foreign body. It's excellent for fractures, so you could do a trauma scan, look at the skull, looking for any fractures, the femurs, lose a lot of blood, see if there's a fracture there or not. Look for pneumothoraces in the chest, look for pericardial fluid or chest fluid, look for fluid in the abdomen and pelvis, thinking it could be blood in the presence of trauma, and look for foreign bodies or shrapnel or bullets. It can be a very useful screen. Again, handheld, if you know what you're doing, it can be very useful. So we're back at the beginning where we started, Marie Curie and the point of care of conflict ultrasound, 1914 to modern day technology on the battlefield. So it's even used in zoos. Elephants are made of soft tissue. Clearly, you'd need a large probe, and so here we have vets using ultrasound on elephants. They're made of soft tissue, and thank you for listening to this talk on the point of care ultrasound. Ultrasound is extremely versatile and can be used in many settings and used in many anatomical areas and many clinical scenarios. So thank you very much.